All right, I'm going to go over the basic anatomy and physiology of the heart. Okay, looking at it from the outside here, you've got your atria and your ventricles, but what else we can see from the outside here are our coronary vessels. I've asked you to name the coronary arteries. So the coronary arteries are going to come off of the aorta, which is right here. And if I undo my heart here, here we go. If I undo my heart, we can see that off of the aorta, we have the coronary sinus, which is going to have the coronary arteries come off of it. And so behind the pulmonary artery that you can't see here is the left main coronary artery. This over here would be the right coronary artery. We talked about how the left main coronary artery is going to turn into the left anterior descending, which is going to feed the whole front left side of the heart, and also the circumflex, which as you can see is going to go around here to the back, and it's going to feed the whole left back side of the heart. And we know that the left side of the heart is part of the systemic circuit, and so if that goes down, that's a big issue. And then your right coronary artery is going to feed the right side of your heart and the right back side of your heart. So the coronary vessels, I need you to know, are right coronary artery, left main coronary artery, which you can't see behind these major vessels here, left anterior descending, and then the circumflex. Also up here, we've got superior vena cava coming into the right atrium. Back here, you can see the inferior vena cava also coming into the right atrium. So you've got right atrium. Let's open this up here. So we've got a little pointer here. So we've got right atrium, down to the right ventricle. In between, you've got the tricuspid valve, which is an atrioventricular valve. And then from the right atrium, we're going to go up through the pulmonary artery. Here's the pulmonary semilunar valve. The pulmonary artery is going to separate into the left and the right. You can see it back here. So the left and the right pulmonary arteries here that are deoxygenated, that are going to go to the lungs to dump off CO2 and pick up oxygen. And then we're going to turn into pulmonary veins that are then going to come back to the heart. And so back here we can see pulmonary veins on either side that are going to bring oxygenated blood back to the right atrium. From there, the blood is going to go through the mitral valve, bicuspid valve, mitral valve, to the left ventricle. From the left ventricle, blood is going to be pumped through the aortic semilunar valve, out through the aorta, and then to the rest of the body. And one other thing that I want you to note here is that here we've got the septum. We can see the interatrial septum here, but the myocardium is going to be much thicker on the ventricles than it is the atria, and it's super thick here on the left ventricle because this is the systemic circuit. We call the right side of the heart as part of the pulmonary circuit, going to the lungs and back, but the left side of the heart is the systemic circuit, pumping blood to the entire body and back. All right, and that's just a little heart anatomy. Sorry about my fumbling here.